training members of civil society organizations and non-governmental organizations on school feeding program monitoring. Health Now stakeholders in the Nigerian health sector have called for more support for Nigerians with sickle cell disease in order to reduce the mortality rate of the disease, especially among newborns. The stakeholders made the call at a research workshop on project and plan execution organized by the Sickle Cell Pan-African Consortium Nigerian Network, SPACNet, in Abuja. Trust TV's Aisha Salihu attended the workshop and now reports.
The late detection of sickle cell disease in newborns make up a large number of under 5 child mortality rate in the country, including maternal mortality. This, stakeholders believe, calls for the need to harness simple, effective and scalable tools to address the burden. The Center of Excellence for Sickle Cell Research and Training, University of Abuja, in collaboration with the Ministry of Health, non-governmental organizations, sickle cell patient support groups, held a hybrid meeting with 25 health institutions spanning the 6 geopolitical zones to prepare towards Year 2 of the project, including takeoff of the newborn screening study led by the Sickle Cell Pan-African Consortium Nigerian Network.
There are protocols for cross-consortium studies. So this protocol that we looked at today, or the 2 that we looked at, have to do with newborn screening, scaling up newborn screening. So we want to look at implementation science research studies on scaling up newborn screening, because as you know, newborn screening saves lives. We know that when you identify babies with sickle cell at birth and you give them prophylaxis for infection like penicillin, like the pneumococcal vaccines, they do well. And if you educate the parents, they do well.
The workshop is aimed at providing more support for access to early diagnosis, better care and management of the disease, records of patients' data collection, assessment of progress and clinical intervention.
Sickle cell is one of those things that made us not to achieve some of those goals. And even now, the SDG 1, 3, and 4, 1, 3, 4, and 10 even. If care is not taken, we might not be able to achieve them unless we are able to address sickle cell disease in our country.
Sickle cell disease is a black man's problem, and NIPRID as a research facility is a center of excellence for research, and we have been the trailblazer in the area of research in sickle cell. We started out with clinical trial in phytomedicine called NIPRISAN. This particular drug helps to protect the red cell from sickling when other conditions are all right. And so far, patients that have been on these drugs have been able, right from childhood, to go through schools without crisis or little level of crisis, and they have been living their life.
Sickle cell disease patients' population require regular appraisal and identification of gaps in terms of adequacy of care, current research, prevailing government policies and diagnostic capacities to tackle the disease's burden and reduce morbidity and early mortality, especially in children. Aisha Salihu, Trust TV News, Abuja.